Hello, my name is Kimberly Martin, and I am presenting on the DBT emotion regulation skill, Please. The agenda for this presentation includes an overview of emotion regulation skills, emotional, wise, and reasonable mind, and then reducing emotional vulnerability, specifically with the Please skill set, along with homework and references. So what are emotion regulation skills? Well, they are skills that are used for regulating painful emotions, which are central to behavioral difficulties. These skills exist in 4 groups: understanding and naming unwanted emotions, changing unwanted emotions, reducing vulnerability to emotion mind, and managing extreme emotions. So what is emotional mind, wise mind, and reasonable mind? Well, let's briefly review all 3 states of mind according to this Venn diagram that you may be familiar with. So your mind has 3 states: the emotional, wise, and reasonable minds. We all possess each of these, but may gravitate towards a certain one most of the time. Reasonable mind is when a person approaches a situation intellectually by planning and making decisions based on facts. Wise mind is the balance between our reasonable and emotional minds, in which we recognize and respect our feelings and respond to them in a rational way. Emotional mind is when our feelings are controlling our thoughts and behaviors, and we may act impulsively without consideration of consequences. The goal is to achieve the balance of wise mind. So we will focus on reducing vulnerability to emotional mind. So this reducing vulnerability to negative emotions or emotional mind has 3 skill sets: accumulating positive emotions, building mastery and coping ahead, and taking care of the body. So Please is an emotion regulation skill that focuses on taking care of the mind by taking care of the body. Please helps build a resilient biology. An out-of-balance body increases vulnerability to negative emotions and emotion mind. So we want to prevent that as much as we can. So what does Please stand for? PL stands for treating physical illness. E stands for balance eating. A is avoid mood-altering substances. S is balance sleep. E is get exercise. And Please is outlined in the Emotion Regulation Handout 20. So physical illness. Well, we need to treat physical illness. We need to take care of our bodies, to see a doctor when necessary, and take prescribed medication. Being sick lowers your resistance to negative emotions. The healthier you can become, the better able you will be to regulate your emotions. Have you ever had a cold that will just not go away? After several weeks, what do? Do you tough it out, or do you go to the doctor? I know that I have neglected my health at times because I felt too busy or unmotivated to go to the doctor. And when I finally did get to the doctor, I found out that I had a sinus infection or bronchitis that could have been treated sooner. Neglecting ourselves can prolong illness and make us less productive and more vulnerable to additional physical and mental issues. Some common obstacles for people needing medical treatment may be embarrassment, especially if it might be an STD, a lack of assertion, a lack of money, problems with self-regulation, fear of medical treatment, or negative previous experiences seeking care. So what interferes with treating illness for you? And how can you overcome these obstacles? Maybe you can make sure you know where your local walk-in clinic is. Maybe you can ask a friend or family member to go with you to the doctor. So now we'll move on to E, balance eating. So don't eat too much or too little. Eat regularly and mindfully through the day. Stay away from foods that make you feel overly emotional. And consider multivitamins and supplements, but always consult your doctor. So try eating the amounts and kinds of foods that help you feel good, not too much or too little. Research has shown that eating both too much and too little can increase your vulnerability to emotional mind. Research has additionally shown that restricting food intake can lead to eating binges and psychological problems. Do you ever get hangry, a combination of hungry and angry, and snap at your loved ones? I know I do. When and how often you eat and your daily eating routine can be especially important for some individuals, such as those diagnosed with bipolar disorder. Stay away from food that makes you feel overly emotional and opt for food that provides steady energy throughout the day. When you do not have proper nutrition, you may feel sluggish and lack energy. Caffeine is especially important to moderate and stop drinking by a certain time in the day because it can cause you to crash later. Too much caffeine can also lead to anxiety, panic attacks, and not being able to sleep. So what foods make you feel good, calm, or energized? Do you plan balanced meals? Do you know what your ideal caloric intake is? So consider checking out MyPlate, an online government resource to educate yourself about nutrition, meal planning, and daily caloric intake. Talk to your doctors about changes in your diet and adding vitamins and supplements that may support your physical and mental health. It is also important to consult with your doctor about how certain foods and supplements may interact with any medications that you are taking. So A, avoid mood-altering substances. Stay off illicit drugs. Use alcohol in moderation, if at all. Alcohol and drugs, like certain foods, can lower your resistance to negative emotions. Stay off the drugs. Moderate your alcohol intake if you choose to drink. Mood-altering substances alter moods. This is why it is not a good idea to drink alcohol or use drugs before a job interview, or before or during other events, where behavioral and emotional control is very important. If you do choose to drink, moderation is key. Many people do not know what is considered moderate drinking. According to the Centers for Disease Control, moderate drinking is up to 1 drink per day for women and up to 2 drinks per day for men. Drinking under the age of 21 is illegal and can be harmful to ongoing brain development. Do not drink if you are pregnant or may be pregnant, and do not drink if you have existing health problems that could be made worse by drinking. S, balanced sleep. So aim for 7 to 9 hours of sleep per night. Keep a consistent sleep schedule. And consider the nightmare and sleep hygiene protocols, Emotion Regulation Handout 20A and 20B. So make a date with your bed every night for bedtime. Have you ever cried over nothing when you felt exhausted? You're not alone. When we are tired, it's easier to get overwhelmed and have less patience and more anxiety. An increasing amount of research suggests that lack of sleep is related to a wide variety of emotional difficulties. I know that for me, balanced sleep is an ongoing challenge. I'm a night owl by nature, and maintaining a regular sleep schedule has often been hard for me. I know that I need to consider not drinking caffeine after a certain time in the day. I wear glasses at night that block blue light from the TV or computer screen to prevent suppression of melatonin, a hormone that helps regulate the sleep cycle. And I avoid vigorous exercise at night. That could keep me awake later. So research has found many health difficulties that can result from sleep deprivation. Lack of sleep has been linked to increased risk of some cancers, diabetes, heart disease, stroke, and obesity. Short-term sleep deprivation can lead to loss of brain tissue, reduced immunity, and overeating of high-calorie, high-carb foods, along with loss of focus, memory problems, increased risk of accidents, and becoming overly emotional. Do you have sleep difficulties? Do you have nightmares? What can you do to help support yourself in developing and maintaining balanced sleep? Discuss your sleep patterns with your doctor, as it can be connected to your mental and physical health conditions and have implications for medication type or dosage. Again, if you want to learn more and have any other difficulties to consider, read the nightmare and sleep hygiene protocols and explore them with your individual therapist. E, exercise. So get exercise. Do some sort of exercise every day. Try to build up to 20 minutes daily. Exercise is often neglected, but is crucial to our physical, emotional, and mental well-being. Research has shown that exercise, done consistently, is an antidepressant. In addition, regular exercise can build mastery or a sense of accomplishment, and over time help you build resilience to negative emotions. Get some sort of exercise 5 to 7 days per week. Try to build up to 20 minutes of exercise each time when you start out. You can consider using the interactive exercise planning tool on the health.gov website to create goals that you can print and share with family or friends. Consider reviewing Interpersonal Effectiveness Handout 20, Strategies for Increasing the Probability of Behaviors You Want, on your own or with your therapist to increase your self-management skills and consistency. So the Centers of Disease for Disease Control has found that only 24% of Americans get enough physical activity. That means that 76% of Americans do not get enough physical activity. Some of the health benefits of physical activity include lowering your risk of heart disease, type 2 diabetes, and depression. Exercise can help you sleep better and lessen your anxiety. Ideally, 150 minutes per week of moderate intensity cardio and 2 days per week of muscle strengthening are recommended. Just remember, exercise does not have to mean high intensity cardio or weightlifting. Taking a walk in the market, a bike ride with your family, or a stroll in a park or garden all count. So homework. We'll look at Emotion Regulation Worksheet 14, Practicing the Please skills. So you can see in this chart, in the left column, you list the days of the week. Each day, you write down what you did to practice each of the please skills. At the bottom of each column, check if practicing the skills was helpful during the week. And have fun building your skill set. As Gandhi has said, it is health that is real wealth, and not pieces of gold and silver. So invest in yourself.